Hi, everybody. I'm Wendy Murdoch, and this is Webinars with Wendy. This is a last-minute webinar that we put in because Alicia Harlow couldn't be with us today. She will be returning next week. But I am so excited to have Dr. Martina Neirdhart talk to us about kissing spine. It seems like this was a really popular topic. It's in 24 hours, just the number of people that have signed in. So clearly it's something that's on people's minds, and I'm so excited for her to tell us all she knows about it. So I'm going to just turn this right over to Dr. Neirdhart. And if you would just give us a brief intro in case some people don't know who you are, which is hard to believe, but that'd be awesome.
Hi, everyone. I'm an equine vet. I'm specialized in complementary medicine and rehabilitation. And I get a lot of those kissing spine horses either to look at when they come in primary with primary back pain, or later down I get them back from clinics after they had like interventions done. So this is meant to be just a short introduction with a general overview, what is causing it, what it actually is, what are the underlying reasons, how we can rehab it, and what are the treatment options. So I hope you enjoy it, and I hope if you have any questions, just let me know.
And so Martina can't see the questions when they come in, so I'll be monitoring the chat. And if there seems like it's an appropriate place, I'll interrupt her and add that question. Otherwise, we'll wait till the end for all the questions.
Yes.
But please do go ahead and type your questions in the chat.
So, overriding spinous processes, or in general language, we call them kissing spines. How relevant are they actually? Because kissing spine or overriding dorsospinal processes are a secondary, how do I say, most of the time they're secondary and not primary. So there is an underlying reason that horses develop kissing spines. But what does contribute to their development? What do we have as treatment options? And where do we have to, how do we have to rehabilitate it? As you can see here, I hope you can see my little arrow. Most of the kissing spines are here in this area where actually our saddle is, and also the back. This has two reasons. A, because this is when we see the curvature where it is the deepest, and also totally naturally between TH 16, 17, 18, around 16, we do have the most narrow interspinal rooms, because there is the orientation of the spines is changing. As if you can see here in that big picture, we have them up till here. They have a caudal orientation. That means they go towards the tail. Then here in that area where we have that that junction, it's called oh my god, now
anticlinal moment.
Yes, thank you. So here it changes orientation, and then from here on 17, 18 on, it goes cranial. So all these spinal processes that we have further back, they go cranial. They go cranial towards the head. So here we have a change in direction. It's the weakest point of the spine, and we have the great idea to sit on top of that. So here, we see a picture of a quite strong change of overriding spinous processes. They occur when two or more bony processes overlap and then start to rub on each other. In between those spinal processes, we do have little ligaments. So that is actually a little bit like a joints hold together, or like on the leg where we have your suspensory ligaments and stuff like them, or your collateral ligaments. To give stability to the spine, we have a ligament up on top here. We have one at the very bottom. We have some in between here. So everything is quite closely connected and stabilized with connective tissue. It's not like a hollow like it looks to be here. unfortunately, up to 80% of the horses do have changes on X-rays that says they have so-called kissing spines. But we know now that we X-ray more backs that having a change on X-ray and clinical signs are not really correlated. Only about 10 to 14% of horses who have changes on the X-rays actually present with clinical signs and pain. Like I said, kissing spines, those 80%, they are from a European study from 98. This one here is a study from Tracy Turner from 2011. He looked at the horses in America. It was mainly dressage horses, thoroughbreds, and quarter horses. And he found kissing spine in over 40% of the horses, but only also in his study, only about 10% did have clinical signs. They were more likely to cause clinical signs when there are more than 3 process spines were affected, and when they had a special form, like thoroughbreds do have a narrower gap between, and they do have a little bit of special shape on their dorsal spinous process. It was interesting to see that he found mainly thoroughbreds, dressage horses, and young horses under 5 years of age were affected, and especially when they had more than 5 vertebrae that were changed, then they did have quite clinical signs on showed back pain.
So that's interesting with horses under 5 years of age. I'm sure you'll talk about why that is.
Yes.
Okay.
We're going to go through those things. This is just a general overview. Here we have the radiographic grading. It's just, we're not going to really go into it. It's just so you know, kissing spine is not kissing spine, and clinical grading can be different. Depending on which continent, America, I think, has 4 grades. Europe has 5 grades of radiographic grading. So it's just like 0 is always totally clean. 1 is narrowing. That's very similar. What is different between the European and the American one is like grade 4 and 5. America just has severe bone remodeling finished. In Europe, you also have fusion of the spinous summit. So that means they already like grown together. So, but again, severity and existence of overriding spinal processes does not correlate with back pain in horses with the severity. Some of them can have like grade 4 changes, and so absolutely no clinical signs. And then we have some with grade 1 or 2 where you think, oh, that's really, really minor, but they are absolutely crippled with back pain. So we still don't know 100% what's the correlation and where it's coming from. So causes of kissing spine that we are going through are going to be genetics, conformation, breed prevalence, core muscle, sport, and how they are ridden does have a massive influence. Foot balance, other pathologies, tack fit, teeth, TMJ. What's not on here is nutrition, because it's like in general, horses do get weak bones if they do not have proper mineral supplement and not fed properly, or if they live in an area where there's a lot of silicate in the water, like for example in California there is such an area. So, but that is like something very, very special, and so I'm just concentrating on the most common things. So if we look at genetics, it's really interesting. There seemed to be a prevalence for kissing spine in certain horses. They did find one loci that causes a 4.5 times more likelihood of horses to develop kissing spines. But it is not the only one that's contributing. But I thought that was very interesting, because out of 50,000 locations on our genome or on the horse's genome, there's just one that causes them to be 4.5 times more likely to develop it. There is some other ones that contribute to severity of kissing spines. That's why we see some with strong clinical changes on X-rays, but no clinical signs, and other with very little X-ray changes, but very severe pain. So there's more research going on that. What I found was very interesting from that research is also it doesn't matter if the horses were heavy or light, or if they were male or female or geldings. That didn't change anything on the development of kissing spine. What did change the probability to develop kissing spine was height. The bigger a horse, the more likely it will get kissing spines. So causes for kissing spines. I found that very interesting. Conformation is one of the big things, and we often forget that. Unfortunately, we started to breed our modern sport horse, so-called downhill, with a lot of propulsions from behind. Here in the middle, we see it. They get a sloped, more sloped hip, relatively high up there. The spinal column itself has a downhill orientation. This causes also additional pressure here. We have more pressure in the whole area where we have the attachment of the core muscles that are responsible to give propulsion from behind to the front. So if we compare two Hanoveraner stallions here, one of here is Goldfish, born in 1949. He was the father, or the original father, of the famous G line, where we had Gotthard and all those coming from the Hanovers. And then here we have another one, same color, but totally different model. If you look here, when he stands, you can see that his spine is actually orientated like that. You can see here the point of the shoulder, point of the hip. It goes relatively steep down. This gives us the orientation. If we compare that here, point of the shoulder, point of the hip, we have a more or less parallel back and orientation of the spine. Also, what we see is like here, we have that dip, especially in younger horses who have not such a well-developed core sling. This will be more pronounced, but this indicates again that the chest area is weaker, and we have the tendency to have kyphosis in the back. You often see those overdeveloped, the overdeveloped part of the brachiocephal muscle, like we have it here, instead of here where it's very straight. And the biggest part, the biggest thickness of the muscle is down here and not somewhere in the middle.
Martina, is this something that we just haven't paid attention to in our breeding, or we've been breeding for specifically but not recognizing the consequences?
That, I think that's what happened, because we have been breeding specifically for spectacular gaits, for more room, for longer gaits, for more speed. We have been losing stability in our horses, not just from how they are built, but also because we have been breeding for more reach and more speed and more recoil, we bred for more elastic connective tissue. So we have a change in conformation in the anatomy, from how the bones are built and how the angles are. And in addition, we have more elastic connective tissue. We have a lot of modern sport horses who are hyper flexible.
Mm-hmm.
We can see that when they're just in a trot, that their fetlock is actually nearly touching the ground. We can see their back is extremely moving. When we have them without rider, they can pull their neck in down to their chest without any problems. This wouldn't have been possible with those old horses. So, breed prevalence. Here we see a picture from a Thoroughbred, because we said, as you can see, they have funny, wonky, bent spinous processes, not as we have seen in the other pictures. Here, this one is specifically like S-shaped, and that's what predisposes, in addition to having very small interspinous spaces, in combination with that big bend that a lot of them do have in certain of their bones, predisposes thoroughbreds to kissing spines. In addition, when they come from a track, we have other contributing factors like poor foot balance, tack that's not really fitting, the riding style. A lot of those horses do not have a lot of core muscles who are stabilizing their back, because they get their stability not through their core muscles, but through speed. And then the other thing is the intensity. They are worked from a young age on, when those bones and a lot of muscle groups are developing, where they have growth spurts and stuff like that.
So has anybody looked back in the thoroughbreds and seen like where that curve in the dorsal processes started coming in?
I don't know. I can't answer that. I just know it's there at the moment. That will be something perhaps to ask Sharon May Davis or so, who has done a lot of research also on extinct breeds.
Yeah, that would be interesting to see.
So that would be, I would ask her that question. Unfortunately, I cannot answer that.
Okay, no problem.
Then the other things, what kind of sport do we and how do we write that sport? Because from the research from the paper from 2011 from Dr. Turner, dressage horses were overly presented in back pain. And he studied those horses, I think, from 2004 to 2011. That's when he collected the cases. If we look at the two pictures here, this is the famous Totilas, and this is Nuno Oliveira with classical dressage. This is modern sport dressage. If we look just how the horses are collected and how they carry themselves, because they're actually both in the same movement here. So what we see is, while the modern sport horse is behind the vertical with a lot of pressure in the gait, we do see a lot of forward motion here, but we can still see that the chest is relatively low. We can see the horse is more rolled up and it's going downwards with his into the chest, while this horse here is coming up. If you just look at the different muscle, how the neck is held differently, which muscles are actually engaged. Here we see a nice one, our T1, T2 is the highest one. Here we have C3. So we have a total different question that we are asking those horses. Here again, if you have the propulsion, you can see here very well how the pressure is going downwards in the modern sport horse from how it is built. You can see this is a hyperelastic horse. Look how low that fetlock is at the trot. Look how low that fetlock is here. And this is also a big problem that we see in modern sport horses. They do overuse and are prone to fetlock arthritis because the stability is missing in the lower limb due to the hyperflexibility of the joints that we have been breeding into them. If we look at the jumpers, when you see they coming down, this is another problem where we have them. You can see, Oh, come in. Oh. Oh.
If anybody has any questions, just pop them in the chat. And like I said, I will ask them at the appropriate moment.
So you can see that we have a major problem in osteoarthritis developing in lower cervicals in show jumpers.
Yeah, can you get your pointer to work again? It's kind of stuck at the top. Oh, that's my pointer. Oh, there it is. There's yours. Okay, great. I was looking at my pointer. I'm like, it's stuck.
If you look at the percentages where we have healthy joints, that's blue in the show jumpers, and then we look where we have severe arthritis, we see that the thoracocervical junction here is the one that is the most affected. So landing down here with the forces coming down, if we go back here, we have again having a problem here because this curvature is over exaggerated in the modern sport horse. So it forces them into already a more or less kyphotic back. And Dr. Gerd Heuschmann did a lot of research on that about functional anatomy and was one of the first ones in the 90s to point out that we're actually causing big problems for the horses if you're riding them with that rolled up neck behind the vertical. And we see that in a lot of riding, be it show jumping, be it dressage, a lot of them are just behind the vertical. That means they can't engage their back properly, and it's more out of tension that they lift their legs and not because they are collected and work over their back. Age, skeletal development, and this is kind of a nice one because what is here really nicely to see, 6 years we have more or less this part that starts to be finished growing, but the withers, the lower cervicals, and the atlas take much longer. They are only finished when the horse has finished growing. Depending on how tall they are, if they are a gelding or a mare, because geldings do take longer to be finished growing because they have less sexual hormones, it can be up to 10 years, 10, 11 years till they are finished. So all the muscle attachment that we have here in the most important area that we just seen is not finished, is unstable. And if we work the horses too strongly and too intense, we will cause problem along here and in the limbs, just because the stability is not there. Rule of thumb for training in horses, 3-year-olds, maximum 3 sessions a week. 4 years, 4 sessions a week. 5-year-olds, 5 sessions a week. If we work them, they start sweating and really have to work. Muscles need 48 hours to recover. If we don't do that and work them day after day, we cause sore muscles. Sore muscles are tense muscles. Tense muscles prevent proper movement and stability and cause wear and tear on joints and ligaments. Horses are made to run, but not to carry people on their back. What we have seen from their anatomy, where we have the anticlinal vertebra here. Now I can remember the word. And so the horses do need very, very strong core muscles. This is the most important. And often they are underdeveloped but often you can't see it because what we do is like we feed them, they're slightly fat. They develop big muscle groups relatively fast, so gluteal and all that. But the muscles who are there to stabilize it, be it a multifidi muscle, be it the scalenus who helps here, all those muscles, they can be still underdeveloped. And also longissimus and iliocostalis. The problem is if the horses are growing and we see up to 6 years, 6, 7 years, this is still growing, they will make growth spurts. Later, they will make growth spurts here. So we always have changes in the stability of our back and in the tension that we have on our back. Just thinking about the lever that we get, like if one of those lumbar or other spinal bones decide to grow 1 or 2 millimeters, that is like quite common that they grow that much in 48 hours. If we have 2 or 3 doing that together, we speak here about 1 centimeter length that the back has changed in 48 hours. That is a massive change in a lever when we think these forces need to be able to withstand those forces. That lever is about 1 to 1.5 meters, depending on how big the horse is. And if we then give that force over to a change here from 1 centimeters, that makes massive changes to the forces going through the back, just because it's such long levers that we're working with. And I think that's also the reason why we have horses 5 years and younger over proportional represented with clinical back pain due to kissing spines. Because
so Martina, when you talk about the 3 to 4 sessions, 3 sessions for 3-year-olds, etc., are you talking about under saddle or just work in general, like lunging?
Work in general.
Okay. So 3 sessions a week, whether it's groundwork, under saddle, long lining.
They have to collect, they have to do side gates, they have to engage their core muscles. Then they can't do more because they're still markedly growing. If we look 3 years on, that's like only finished till here.
Yeah.
Everything else, where we have the core muscles, where we have to get the force through that comes from the ground and go up there, that's still growing. That's still changing. The levers are changing. The forces are changing. The strength where the pull is changing. So there's a lot going on just by them growing.
And when you say a training session, approximately how long is that individual session?
Depends on how strong the horse is.
Okay.
That's the same with us. Like when I'm unfit and I have to do 30 minutes, that's like, oh my God. But if I go regularly for my run and I'm happy, I have no problems running for an hour. So it really depends on their fitness. And
so you have to really pay attention to the horse and his signs of fatigue.
Yes. Okay. Yes. And that depends. And what's really interesting when they're growing, they will be able to do one exercise without any problems for a certain amount of time. And then 3 weeks later, they just can't. Because when they have a growth spurt, a lot of energy is already used up for something else, or there is more instability because they're growing. And then they are only able to do the exercise perhaps 3 times instead of 7 times. So we really have to pay attention how it changes and how fit they are during that time.
Okay.
Does that make sense?
Yeah, absolutely. I can remember my Clyde Thoroughbred cross could not do a 20-meter circle until he was 6. He just couldn't.
Yeah, no, they just can't. They're unable because like doing a tight circle, especially at a trot, uses a lot of core muscles. And I mean a lot of core. Usually you start at the walk for that. Right. Otherwise they're just not able.
Yeah. And someone's asking the best way to develop the thoracic sling, but I think you're going to talk about that later.
Yes, we do.
Okay.
So causes of kissing spines, pathology. Like I said, kissing spine are usually secondary. Like what we saw, like there is a primary cause for kissing spine that is genetic. And that is the only thing, but that affects about 1.5% of all horses. But we have like much bigger percentages that actually show clinical signs or show radiographic signs of kissing spine. So why do we have so much? Underlying problems, facet joint arthritis, like we have it here. And you can actually X-ray in a clinic. Here you see it very well. Then here you see two, the one with the kissing spine. Can you see here?
Yep.
Here it's nearly fused. This is not normal. Here we have how the facet joints should look, these two. Then they can also have spondylosis. It's not just dogs. Here we have a very nice X-ray. You can see how then here we have a disc that's not 100% working. Here you can see radiolucency, how that shouldn't be. So also horses do have spondylosis. So that means they can have the same pathology as we do, or we know from other animals, disc prolapse too. There was always was said, oh, horses can't have a disc prolapse. They do. It's just a little bit different than in us because their disc is different than ours. It doesn't have a nucleus. It is like more like a dry onion that has several layers, and not like one of those Mentos with a soft jelly inside. So it's just a little bit different from when it prolapses. The horse one, it dries more out and then wears out, but it can also go inside, and there is reports and clinical reports from horses who actually had prolapsed disc, who causes compression of the spinal cord and nerve pain like that. Vertebral fractures are quite common, especially in thoroughbreds that have been raised very early, or horses that have been trained too fast, too early. Now, when we can actually look, and a lot of more dissections are done, and we look at spines after the horse had died, up to 30% of the population do have one fracture of their facet joint, or of part of the spinal bones at one time in their life. And we do forget that. Then limb pathology. If we have a problem on the limb, it will affect the back higher up. There was a really nice study end of the 80s. I know it's far gone, but it was over 500 horses. And it was really interesting to see that 24% of the horses that came into the clinic to be evaluated for back pain actually did have lower limb pathology. So the back pain is often secondary. Tells us again, kissing spine is not primary. Kissing spine is usually secondary. ECVM is another one, because we lose stability to the most important part of the body for the horse when it comes to transmission of forces through the body. And if that's not there, if that's not stable, then we're going to get a problem and a compensation further down the spine. Then we talked about the core muscles. Here are those famous multifidi muscles. They are quite finicky. If there is an inflammation either in the rib heads or in the facet joints, or a nerve impingement or something like that, they stop working. They start to atrophy. That means the big muscles up top are still fine, but these little ones are not. And these are the most important ones for the stability of the back. And we can't see that without ultrasound. You can see that from how the horses move and how they react. But, you know, like you still have those big muscle groups. But if these ones are not 100% working and not innervated again, and if they're once atrophied, they do not come back if they are not specifically trained. The big muscle groups can be there, but these ones need extra training. That's why core muscle training is so, so important. Then foot balance. Everybody knows I love my feet, but this is a very nice summary that Yogi did about poor foot balance, especially long toe, low heels, or negative plantar angles. This is specifically for the hinds, where we get pathology. And it's literally like all along the dorsal line. So it's proven that all like hook, suspensory, stifle, gluteal, SI, lumbar, everything is connected to poor foot balance. Yogi did a new one where he was looking at the lumbar fascia too, and is very clearly, and kissing spine, and very clearly there was a positive correlation. 12 out of 12 horses did have a problem there if they had poor foot balance. What actually makes sense, if anybody wants to stand up once and just lift up your toes and stand just on your heel, you can feel the tension that going through your muscles and up. And what happens is you go in a hollow back. So you go into a kyphosis. And that's the same that happens to the horses. The moment we have a pull on that myofascial line, we're just going into that compensation pattern.
So does the limb pathology, does it matter which limb it is, or is it any limb?
Any limb.
Okay.
We do have a little bit different presentation if it's a front or it's a hind, but it's just like which areas are more affected. If it's a hind, that's why I made those myofascial lines. You can see everything starts at the feet and at the head. But if we have a problem in the hinds, we have more the top line itself. It comes mainly up here and here. If it's coming, if it's more like a breakover, that's affected. If we have front limbs, we find the most problems here and up at the neck. Wow. So this is very much affected. I do have a video where we can see that, because there is a very nice test that you can do with acupuncture, just see when you get the tension away from that myofascial line, do we have still sensitivity up in the back. Then here, when we have a contracted ventral line, so if we have teeth problem, where we also go later on, or something that is affecting the lower cervicals, we're gonna get that kind of stance. Or if we have an overload of the dorsal myofascial lines, where when we have a problem with the hinds, then we also get into that kyphosis. So we can have two problems that are actually affecting that, and we get a stance like that. So this is the video I wanted to show you how to check for sensitivity. This horse, if you see here, is quite sensitive. Here, it's a very nice big boy.
Yeah.
You can see he's sore there.
Yeah.
He was uneven landing and loading on his foot. I just wanted to be sure that the back pain we are seeing was secondary and not primary. So there's like just through three simple points down there at the foot, and you can see how he already starts to send out, and it's literally within seconds you can see the sensitivity here is gone. There's no sensitivity through the back, because you can take out the tension on that myofascial line.
Wow.
And that's for me always easy. Then I can see is back pain primary or secondary.
Yeah.
So ill-fitting tack. Here you can see when we have, for example, a too narrow gullet, one of the important parts that get pinched and injured, and they can be quite extensive scar tissue that develops. And then we have quite marked restrictions in the movement. So we can have soft tissue injuries up here, or scar tissue conformation, affecting again our dorsal myofascial line. And then we have then we have again the problem that it's not functioning properly. So these are really, really important. Those iliocostalis, spinalis, and rhomboideus, they're often severely affected if we have an ill-fitting saddle. We do often see hypertrophy of the latissimus when the trapezius is compressed or not working 100%, because he has to take over more of the stability for the front end when this one here is not working 100%. Oops, sorry, this one here is not working. So and pain receptors can get stronger and stronger. The longer horses do have pain, and it doesn't matter where. There's a very nice study who came out from Dr. Hausler 2021, where they looked at horses with back pain and what change it caused in the central nervous system. And they found out that horses with chronic back pain and anything over 8 weeks was deemed as chronic, where they did see changes, caused the dorsal root ganglion to be enlarged. That means those horses will react more sensitive to normal input. Hypersensitivity and hyperesthesia develop from pain. You have to think about, usually pain nerves, the nerves who are responsible to give pain up to the brain, are very slow. They're so-called C fibers that we have. That means they're not myelinated, they're relatively thick, they're very slow. So this is kind of like a little path through the forest, winding through. That's about the speed that information goes forward. When we now have constantly input into those fibers, they will get faster and they will get bigger. A little bit like when you have a road through the forest, there is a lot of people going through constantly. It will get bigger and wider, and you can go through faster. And if there's more information needed, then you build it out. It will be a bigger road. And at the end, you have a highway. So the same information will need way less energy and way less input to go from being there to the brain, and causing like that a wrong input. So this means a normal touch can actually be painful for those horses, because their nervous system has been altered already to that. And Dr. Hausler could prove that with his research when they found that the dorsal root ganglions already did have changes. So acting when the horse is just showing minor signs of back pain or pain is really important, to not get that ramp up effect from the nervous system, because to downsize it so they're no longer too sensitive is very, very difficult.
So is that true in people too? Is that the same process?
Yes. Usually we know from the research from people after 8 hours, we do have the first changes that happening in neurotransmitting of pain. So after 8 hours, we start to get a change. And it seems from the research from Dr. Hausler, after 8 weeks, we do have a permanent change to the already to the central nervous system. That is visible under the microscope.
Wow.
So
yeah, because I know with
very,
people,
very painful. But we know that from people, you know, like if you had your horse and you kind of like stopped at the tree because, yeah, you know, you hit your knee or something like that. That knee that was thick for several weeks and was painful for a long time, if you now try to kneel down on the floor, you will have problems. You will not be able to kneel as long as it was before, because what is normal pressure is now causing pain, because you have an altered pain path now. And
you can reset that.
Yes. Right? But it's very, very difficult. It needs special training. It needs special physiotherapy. You have special tools like EPMF, acupuncture might help, also retraining from resetting your neural system with special exercises. But you can't really tell a horse, now you look to the right and you put your tongue to the left and stuff like that. So we need to look for other ways.
So, I mean, I could do a whole webinar just on this. I find this so fascinating because, you know, I know in humans now they're doing more to give pain meds like even before surgery so that there's less pain in recovery.
That's exactly because of that. Because once it starts ramping up, it gets really, really difficult. Pain gets really difficult to be controlled because it's no longer the nociceptive input that causes the pain. It's normal touch that causes pain because you have an altered nervous system.
So that's, I as an example, then, you know, the thoroughbreds that don't want to be touched, right? I mean, there's a fair number of those out there, like, don't touch me. They've probably had pain long enough that their nervous system reports pain instead of, this is nice, this is a touch.
Yes, and it's actually painful to them. So it's quite difficult to work with them. So I had a few cases with those, and those are cases I do put on gabapentin because that is something that helps with distal nerve pain. So we literally need something to alter our neurological input into the brain. And if it needs to be chemical, in addition to actually be able to touch them and start working on them, and they starting to build up the correct muscle groups again to get the stability back, then so be it. Then they're going to be 8 weeks under chemicals. Okay.
So I'm going to bring you back for a webinar that's specifically to talk about that because I find that incredibly fascinating, but we have more to do here.
Yes. So causes of kissing spine is also the other end that we saw by the myofascial lines is teeth and TMJ, the whole head part. So dental occlusion is really important. TMJ itself, the joint. Sometimes horses do get arthritis there. Then bit pressure, be it in here onto the tongue, because that affects again our deep ventral line and hind end propulsion and movement of the back itself. And the other thing is the tack has often especially the new fancy ones, they all do have their buckles right under the TMJ or on the TMJ. Yeah. Because it looks nice. If you look at old tack, most of them you were closing them down here or here, where we don't have a problem with the buckles. But now everything is up here and everything is together, and then we have 3 at the same spot, actually right over the joints, and that can cause problems with bending to one side or to the other. Because usually we have more of the buckles. We have at least one more buckle on the left side than we have on the right side, just because everything is built up like that. H, don't forget H. Be it from teeth erupting and having caps and stuff like that, so they get tight a little bit up here, so that can cause a little bit tensing up in the neck and in the back. Or when they get older and we have expiring teeth and we have like teeth that get an infection or start to fall out, then we have the same problem again. Treatment options. Now it gets fun. The most important problem is find the underlying reason and work on that. This is really, I can't emphasize that more than anything else, because otherwise we are just treating symptoms. And this is just a Band-Aid. So we're not working on the origin. And that's why if we only do work on the symptoms and we just do an operation or we just do injections alone and not change anything, it will come back or it will not go away. So you have to find the underlying reason. Is the foot balance okay? Is the riding too intense? Is the ground too deep and the horse tires because of that too quickly? is the tack really fitting? Does he change teeth at the moment? All those things are really, really important. Then one of the strongest and best treatment options for equine back pain is manual therapy, chiropractic, and acupuncture. This is proven, and that should always be the first defense line and the first treatment that gets used. Because most of the time, if it's just slightly painful due to muscle imbalances, tight muscles, and slight inflammation, this is enough, together with a normal anti-inflammatory, like a little bit of bute or fibrocapsid or something like that, to just stop the pain and get them back into working once the underlying reason is treated. Shockwave is another option that we can do. What shockwave does, the theory behind this, it kills off the little nerve ends and the receptors, so they do not feel that abnormal input into the back, especially when it's a little bit more than just acute and it's already going towards chronic. Shockwaves can be very, very beneficial, often in combination with local injections, where we gets the inflammation under control, especially when X-rays revealed that there is facet joint arthritis also there. Then the dorsal spinal processes do not need treatment. We need to treat then the facet joint arthritis, because this prevents you from building up proper core muscles, and then work on the core muscle strength again. Mesotherapy is the same as a pain treatment, but just along mainly for the muscles, and not as deep as local injections, where we go for joints and nerves directly. The last defense is operation. But again, operations are only successful if we work on the underlying reason and do that. The success rate from operations, be it the ligament cut or even the bone shave, where we take away bone material, is around 70%. So that means there is a 30% failure rate. Yeah. And I think a lot of those 30% that fail is because nobody has been working on the underlying reason and hasn't been doing a proper rehab. An operation will be unsuccessful without proper rehab and proper foot balance.
Has anybody done a long-term study on these horses post-surgical to see what their function is 5 years out?
No, I think the longest is 18 months, and that's where those 70% are from.
Yeah, and I'd just be curious about this amount of scar tissue that
I'm not a big fan.
Okay.
I've seen 2 cases where it was very, very helpful. I've seen way more than 2 cases where it, in my opinion, could have been done differently and caused more instability in the top line, because you're literally taking away the last little bit that is actually holding the back together. The Equitopia did, if anybody wants to Google it, they have that on their Facebook page. They did an absolute brilliant video together with one of the universities, where they actually looked into how much muscle engagement is actually changing the space of the dorsal spinous processes. And there was a massive, massive change just from engaging the core muscles. And it's a 10-minute video, and it's really, really well visible how it can change back muscle stability, and from touching to non-touching just by engaging core muscles. But it's a lot of work. And if you have a back that is already in back muscle fatigue, we speak 12 to 18 month rehabilitation time.
Wow.
It takes a long time.
So it seems to me that being able to pick up on a low grade back pain before it ever gets bad would be really important for horse owners, so that they're not going down this path.
Yes.
Okay.
Absolutely. And core muscles, like here is a very nice picture of a correct sideways in a correct held body position. They're needed for posture and stance. They are needed to be able to bend and rotate. They give stability. Anybody who ever went down a stair and thought there would be another step and then there wasn't, and got kind of feel the hit going through the leg and up into the back, this is the missing stability that our core provides when we think, oh, we're going one down. And it was just not there because we thought it's going down lower. So this is for us to realize how important core muscles are to give stability for every step, because they contract for every step we do, and the same for the horses. And for them, it's even more important because they do not have a clavicular. So all that holds up that body against the gravity is literally muscles. Otherwise, their thorax would just fall through.
Yeah.
Then they transmit propulsions from the hind to the front. Balance, side movement, and that's why surefoot pads are so important. They also give proprioceptive input and help with posture and stance. Here is a very nice example from the same horse with a stable core and without.
Wow.
One. Here you see it as a 3-year-old, and that's as a 5-year-old. Just the difference, how it's leaning. And that's why we get so many splints when they can't rotate their thorax to actually balance and engage their core. Core muscles prevent a lot of injuries in the lower limbs. If we have strong core muscles, they are less likely to injure their lower limbs, especially repetitive microtrauma like tendon injuries, ligaments, and all that. If the core muscles are strong and stable, you will not get those problems lower down.
So that upper left picture makes me think that, so many people want to work their young horse in a round pen with a deep footing, and the horses are going around on an angle like that. And so they're really under
that very short and at a very low speed. So the horses actually learn to do that, but just chasing them around, that's okay to do a join up so they learn, but then that's it.
Okay, so short duration.
Yes, especially in deep footing, because they're just fatiguing much faster.
Right.
They need short repetitions. Core muscles do fatigue relatively quickly. Anybody who has been doing those planking exercises or something like that for 20 years, you literally start at a few seconds and then build up over 30 days to about a minute or so. And this is how weak core muscles are, how quick they fatigue, and how short the repetitions need to be. There is a very nice training program. It's called Equikinetic. And they work the horses in the beginning at a walk, in a cycle, in a circle with bend straight, 45 seconds to one side, 45 seconds break, 45 seconds to the other side, and that's one cycle. And then they repeat it 6 times, and that was it, and the horse is done.
Yeah, I think people don't realize what it takes to develop correct muscles and postural strength in young horses. They just look at them, and your comment about they're a little bit on the fat side, so they think they have muscles when they really don't.
No, especially not the core muscles. They might have nicely developed big muscle groups, but that makes it even worse, because then you have to pull off those big muscles on the growth plates, and then they predispose them even more to being unstable and develop arthritis.
Yeah.
So equiband systems are another really nice possibilities, because especially the belly band, because it engages that walking over poles, hill work. Then I like the wither and SI rocking, especially for the older horses. That means you just hold the withers very gently, left, right, back, forth, just to get them to engage their core muscle. What you can see is their chest muscles start to work, their abdominals start to engage. And this is actually core muscle training. Just do that 5-6 times. And you can do that when you come and say hello to them. You can do it the next time after you've brushed them. You can do that when you take the saddle away. So you do a lot of little repetitions that are done in 30 seconds, but are actually very beneficial to the horse.
So I want to ask you one question about the Equiband system, given what you just said about short duration. Do you find that people are leaving it on too long?
If you follow the instructions correctly, they should, in the beginning, not be on longer than maximum 20 minutes after the horse is warmed up.
Okay. Yeah, because that's my concern with something like that, is people don't pay attention to time.
Yes. So that is like what Narrow Stops and Hillary Clayton have been pointing out quite markedly when you work those. Put a timer. Yeah. It's going to be 20 minutes. Do it every other day, not every day. Just to build up. It's really important to follow those things. Otherwise, it's not going to work, because you cause tense muscles. If you have tense muscles, they're not gonna build up. A muscle needs to be relaxed to be built up. The moment it's tense, it's not going to be built up.
Well, and that's the same thing with surefoot pads. I'm always telling people short duration in the beginning, 15 seconds per foot. And, it's so hard to get people to realize that that short duration is going to do a whole lot more than a long duration in the beginning, especially.
Yes. Yes. Here is another one that's Narrow. That's a really nice booklet that they made, the rehabilitation of the lame horse. I really like that. It has a lot of good exercises, and you see how you should do core muscle exercises with the cookies correct. And they did some research on that. After 5 repetitions, hold them ideally for 5 seconds. And that's it. 5 repetitions for 5 seconds per day. Yeah. And that gives you, after 6 weeks, measurable changes in multi-feeding muscles. They have and spinalis, they have been measuring that. And that is really important. 5 times 5 seconds. That's it. So then, like we said, pole work, you can, when they get better, it's also nice for proprioception. It also helps them to learn where to put their feet. There is a nice study that came out that from the UK, where they were looking at the engagement of the core, and it's really proven that pole work does help with core engagement. Hill work is another one. That's why I put that picture here at the bottom. You can see how the horse is actually engaging his abdominal muscles. He goes forward. It's really important not to have them behind the vertical when they're doing that. Also, when you go uphill, it doesn't have to be a big incline, just slightly upwards. Just walk, stop, walk, stop. This is quite intense when they have to go against with a slight incline, and 5-degree incline is already more. Or when you walk downhill, stop, back up, walk downhill, stop, back up, walk downhill, or just backing up downhill.
So I have a question here. Is the book that you're talking about Rehabilitating the Lame Horse?
Yeah.
Horse and then there's Dr. Hillary Clayton's Activate Your Horse's Core, which is what some of those pictures are from.
Yes.
So activating.
That should be Activating Your Horse's Core. Is the same pictures.
Yeah.
It depends which one you're getting. one of them, I think, is sold out and wasn't available in print for a while. I would just go and see which one you can get.
Activating Your Horse's Core is actually on the Neirdhart Method shop, so people can get it
Perfect. Yeah, that's a really, really good book if you can get that.
And then somebody's asking, should the horse move well on the ground in good posture before adding the Equiband system?
Yes, because otherwise you are training a compensation pattern. What I always recommend when you work with them, start with the belly band. And once they're able to carry themselves, and don't combine it with anything restricting their head and neck.
Good point.
So that's really important. Otherwise, you take away what you actually want to achieve. They need to learn to balance themselves. They need to do that themselves. So what you can do, if you have a cavesson, that's fine. So you can keep the head where it should be, but no side reins, no elastics, nothing. They need to do that themselves, and they will. They just need to be strong enough.
Yep.
Side movement is another one that we've seen in the previous picture with the nice knapstrupper, like if it's done properly. Equikinetics, we already talked about that. He has another one that's called dual activation, where you have the blue and the yellow, either cones or poles on the ground. It's just giving proprioceptive input in addition to stabilizing movement from the core. Then, like I said, the surefoot pads, they are really, really helpful for especially horses who are already in a compensation pattern because of pain or tense fascia. And always start at a walk. If they can't do it at the walk, don't even try it at the trot, because then you go into a compensation pattern where they do it with speed and with splinting, and then you do not get buildup of muscle. You need to start at the walk. That's also where we build up the most muscles. I liked that video because that's really at the end. I was a little bit slow of filming that. But here you can see how much the core is actually moving. She's really enjoying it.
And she's so cute looking back like that. It's so cute.
Yeah, because I was filming. She's like, what are you doing?
Yeah, but that's whole thing is being able to look back while she's on the pads and being able to still use her core muscles. That's an even greater challenge. It's one of the things I look for is, can they move their head around and watch how that affects them. This is an awesome video.
She really loved it, and it helped her. She got very, very tight up top. She does have some arthritis, but she had unfortunately a bout of laminitis, and then she just was tight all over the body, and it was really hard. And that helped her so much to resolve it herself and to just help. And within 2 sessions on the pads, she was no longer sore up top.
Oh, awesome. I don't know if you're aware, Martina, but at AAP that just occurred, there was a study presented by Jesse Cathcart and Valerie Mormon and Katie Ellis. Sorry, I messed their names up. But the paper was a short-term use of balance pads on postural sway and multifidus muscle cross-sectional area in horses. And the research is showing that you can develop multifidus using surefoot pads.
See, perfect. That's why we have it in here.
Yep, it's finally we're getting some research.
If you see those movements, it needs to be like that, because otherwise you do not get those movements. It's biomechanically not possible not move your legs and move your whole body without your core muscles. So any questions?
I don't know. Does anybody have any questions? They ask questions throughout. One of the things somebody suggested, and I agree with, is the Tellington Touch body wraps. That
oh yes, the figure 8 is absolutely brilliant for that, and it helps them to find their body posture. And in certain horses, it works even better than the Equiband system, because especially if we have those who are already falling through in their thoracic sling, not just for the back, who are really like weak already, where the thoracic sling is already fatigued and they need to learn to engage their chest again. Absolutely brilliant modality. That's also when tactile stimulus from beats, you know, the rhythm beats are also helpful for those horses, because it just reminds them to use your chest, come up. Really, really helpful.
Yes, and the title of the book is all wrapped up for horses. I couldn't recall it previously.
Yeah. No, that's very, very helpful, and I wanted to put that in, but I forgot. I'm very
It's okay.
Sorry.
No worries. We got it in.
Thank you for that add-on.
This has been a fabulous presentation, Martina, and you know, I always learn so much from you, and I really appreciate you taking the time to so thoroughly describe this and explain to people that there's probably an underlying something that hasn't been addressed that is then this is secondary in a lot of cases. And just the fact
like I said, 1.5% of all horses are genetically predisposed. So there's like even more important for them to have like strong core muscles and all those exercises, but everything else is literally secondary.
Wow. All right. Well, I'm going to bring you back for that other discussion about pain, because I am fascinated by that. So we'll make sure we get you booked probably in the new year. And thank you so much for presenting this today. I really, really appreciate it.
You're very welcome. And thank you for everybody who had time to come and watch.
Yep.
I hope you enjoyed it.
Just remember, we'll have this posted. We'll send everybody who has subscribed to the webinar, we send you a link so that you can get directly to this webinar. So stay tuned for that. Thanks a lot. Everybody have a great weekend. Bye.
Bye-bye.